This is Andrew Bitts, and I am very excited to share my Tree of Life presentation along with my mind map. It's been an exciting program and a great way to cap it off with a project that I've been working on for the last couple of years. The agenda I wanted to focus on today for the Tree of Life is defining what it is, what does it bring to healthcare, and why did I choose it as my capstone, the overall innovation process to get there, the evidence supporting the Tree of Life, outcomes that will hopefully come out of the Tree of Life that we expect, information technology tied to the Tree of Life, policies affected, my overall finance plan, as well as leadership structure, and the objective too with the change theory teamwork. So what is the Tree of Life and what does it bring? Well, the Tree of Life was actually created by Mayo Clinic here in Phoenix, Arizona by Dr. Ken Meshark about 6 years ago. It was piloted at Mayo Clinic over the course of 6 months and was piloted more in a setting of patients that were only staying overnight or maybe for 2 nights. And that was part of the reason why it wasn't very successful and it didn't really catch on. Another reason that Dr. Meshark believes was that they didn't have the proper amount of stakeholders, there wasn't a lot of ownership, and the overall questions that were being asked in the Tree of Life didn't seem to have an impact on what the patient and the provider really wanted to talk about in a setting. And really at that time in 2010, there was still a lot of the reasons for people getting reimbursed, providers getting reimbursed, was more based on quantity, and providers wanted to get in and out of the patient's room. So we're definitely at a point where Dr. Meshark was looking to start this up again, but look at a different setting, look for someone to take over. And so that's where I came in, and with an internship actually through ASU. I worked with him, put together the Tree of Life, a different tree, something that we felt would have a bigger impact. But we also spent a lot of our time on where to test this. And we felt that the best facility where people will be more apt to talk about some of these things was at a hospice facility, and at a fine hospice location at Hospice of the Valley in Phoenix here. The innovation process to get there was really focused on the tree itself and how can we get the most amount of personal information out of the patient in the shortest amount of time. And so here on the right was my prototype that I put together on things that I thought were especially important for the patient to share. Once again, this tree will before it goes into the electronic medical record, it'll sit as a poster on the outside of the patient's room. And this is really the case for the innovation was built around sharing the most amount of information that they're willing to share to the public and to their providers and physicians to know about them before they treat the patient. And then coming with the selection of the pilot location, which I have decided is Hospice of the Valley. Outcomes that we expect out of the Tree of Life, we really are focused on leading Hospice of the Valley to better health care, and once again, higher quality of life, increasing average length of stay, and our ultimate goal is to even have patients leave hospice because of having better relationships before the end of their life. How the Tree of Life may evolve over time. There's a variety of ways. We know it's not in a perfect form right now, but we do anticipate it to change. Like I mentioned already, going to an electronic format. We may decide to change the tree altogether, put it in a different location, mainly only focus on certain avenues of care, etc. And as you can see in the chart here, there's certain quantitative and qualitative data that we plan metrics that we plan on looking at. One, for instance, here at the bottom is reduce end-of-life costs in America. This is a huge issue in the United States, as we know. And if we can have more facilities, not just hospice, employ something like a Tree of Life and have more people in the end-of-life care setting at a less expensive cost, we would definitely benefit the entire health system. Evidence for the Tree of Life, there's so much evidence out there that talks about the importance of strong relationships, personal relationships with providers, nurses, and their patients. One being such, it increases patient determination, motivation to get better. They feel held accountable by their practicing physicians, and they want to get better, and they want to prove that they can do it because there's more of a relationship there. There's definitely a higher quality of life for hospice patients with positive scores of these. The patient's symptom distress, ability to function, interpersonal communication amongst not only the physician but also a lot of their friends, their ability just to communicate. Personal affairs are in order, and overall religious comfort is very important. Another higher quality of life evidence that we found are the below attributes are focused on to increase connectedness between patients and providers. And connectedness is really the term that's used here and between patients and providers. So there are high levels of intimacy, sense of belonging, caring, empathy, respect, trust, and reciprocity with their provider are all very essential to increasing the quality of life, which the Tree of Life definitely focuses on. And then evidence from user input, we're really going to focus on the people that are using the tree, the patients' families, and definitely the Hospice of the Valley staff as well. What have they found to be, just in a live setting, to be the most important part of the tree, where they find themselves talking about during the course of a visit. Like I mentioned, we do plan on initially bringing the Tree of Life on a poster, 24 by 36 poster on the outside of a patient's room. That's the initial plan, with the ultimate goal to enter the Tree of Life into the electronic medical record, so it's there in the patient's chart when the physician pulls up the patient and they go to the room to treat the patient. It's part of the actual visit, part of the medical history. Some of the graphs here that I'm showcasing focus on IT assets. First of all, some of these things such as like application systems. This will really be the overall software development, and we will, one I like to highlight, we will need to have a very good vendor relationship with their EMR vendor, Allscripts, in order to get some of the integrations done with the Tree of Life into that EMR. As far as IT governance, this is very well thought out as far as all the stakeholders and the types of responsibilities they're going to have and when. My favorite part of this and what kind of put the most thought into was, when is this complete? So this kind of can show where are we in the process on delivering the tree to a patient, but also where are we in the process of bringing the Tree of Life to a different Hospice of the Valley location. I hadn't mentioned this, but we are starting in one Hospice of the Valley location, the Sherman House, and so this IT governance will be used as a model for all facilities to have in place to be successful. For the overall leadership structure, I really wanted to focus on the type of vulnerability that is encouraged by the Tree of Life. First off, our leaders really need to be open to changing the tree in the future. Like I mentioned, we do not have a perfect tree right now. We are in a pattern where we're trying it out at the Sherman House of the Hospice of the Valley to learn more about how to make it better, not only in poster form, but electronic medical record form as well. The biggest thing in here is we need to trust all stakeholders that are part of this system, and we can't assume that one stakeholder is more important than the other. And that really, that goes to the leadership of having really an absence of ego across the team. But definitely at the higher up, the hospice facility directors can't assume that their role is more important. Everyone needs to contribute. The overall finance plan for the Tree of Life, this is one of the more exciting parts of my research and putting together why I think this is so important. On the left talks about the return on investment for the Tree of Life, and this really focuses on, as an example of increasing the average length of stay from 4 days to closer to 8 days. And we looked at that as Hospice of the Valley normally gets reimbursed. Most of their funds, most of the money that comes in comes from Medicare at $157 per day. So if we're able to double that, we're really looking at close to $500,000 per year facility on average additional per year. And as I put it in here, I looked at a 3-year for return on investment. That's typical with some of these projects, almost $1.5 million per facility, which is really exciting. Some of the expected costs at Hospice of the Valley, you're really looking at the labor costs as well as the The training cost involves some maybe consultants that might need help. And then you're looking at some of the miscellaneous costs such as iPads to enter some of the Tree of Life data. Tree of Life systems thinking, here we're really looking at, more of a systems thinking type environment, part of Objective 2 here. We're looking at ubiquitous delays, some of our bounded rationality. The Tree of Life was created in the best version for what we know now. We know that things might need to change simply on what we don't know what's going to happen. There's layers of limits for the tree to grow at Hospice Valley. We need patient cooperation. We need patient families discussing Tree of Life to other families. And our biggest limiting factor is Hospice of the Valley staff sharing the right information from the tree during a patient visit. So they're not talking about something that the patient, even though it's on the tree, might not want to dive into at that point. And here's just something I wanted to focus on. The Tree of Life can act as an example on how a new idea can be discussed, built, and implemented and scaled to be available system-wide at Hospice of Valley. So the Tree of Life can really be innovative motion in itself for other innovative ideas. Also part of Objective 2, this really focuses on my innovative leadership skills and what I feel like I have strong suits in. My background really is focusing on new ideas and selling them across the organization, so I'll continue to be involved, especially during the points in this project where people just aren't seeing how the Tree of Life can be successful. I'll continue to sell on the impact that it can bring. I really do have a true passion for improving quality of life for hospice patients. This capstone was really about the Tree of Life, but also combining it with my background in hospice and volunteering in hospice and how to improve the overall hospice setting. I'm very proactive in my approach. I can see things before they're actually happening and can bring them up in meetings and discuss. Discipline in my work, I know the importance of hard work and staying with something and not giving up if you're not seeing it successful right away. And I really try to approach situations with vulnerability. Once again, I know I don't have all the answers, and I want to see others take the reins of this. I don't want to come in and tell people what to do. I want people to tell me what to do, or even keep me out of it if I don't need to be part of it. And the overall mantra of this project and working with Hospice of the Valley is, although stakeholders have the responsibilities, no one should ever really say, sorry, can't help, that's not my job. Everyone needs to be part of it. So really in conclusion, once again, the Tree of Life is a tool to improve quality of life for patients by building stronger relationships with hospital staff. We're really focusing on just overall quality of life and making the most, especially on the last days of your life, by sharing your own legacy and creating your own legacy. We're doing the pilot at Hospice of the Valley. It'll be very exciting to see how it goes and where it leads. We anticipate that our outcomes will bring better health care at a much less cost, and evidence really shows increased patient motivation and higher quality of life when they're interacting more with their physicians. We have many stakeholders that are part of this IT technical rollout, especially in the future when we go into EMR, integrate into an EMR. We'll create greater leadership vulnerability. The estimated expenses and ROI really look positive. I think that's one of the highlights of this overall project. There's very little risk and high reward in the future. And my leadership can allow for always allowing the process to change, and all stakeholders need to be active participants for this to succeed, absolutely. Thank you. I've really enjoyed this program, and sorry I went over a little over, but have a great evening.